Welcome to Rare on Air, the monthly podcast from EURORDIS Rare Diseases Europe. I am your host, Julien Poulain, and once a month, we will be exploring the challenges, experiences, and successes of people who live with a rare condition. In today's episode of Rare on Air, I discuss the latest results from EURORDIS Rare Barometer's major survey on the diagnostic journeys of over 10,000 people across Europe, either living with a rare disease or living as a close relative of someone who does. To set the scene, I speak to Ayça Şahin, a PhD student studying neuroscience in Turkey, who has spinal muscular atrophy, or SMA for short. Ayça shares the details of her and her younger brother's years-long journeys towards being diagnosed with SMA during their childhood. Although grateful for the diagnosis she received at age 7 and the diagnosis her younger brother had also received, Ayça discusses the importance of an early and accurate SMA diagnosis and the positive impact it had on her family's life. Reflecting on Ayça's story, I then speak to Jessie Dubief, our Social Research Director at EURORDIS and the lead of our Rare Barometer survey initiative. Jessie explains our survey results, highlighting the long waits for diagnosis that Europe's rare disease patients experience. Among the key findings is that the average rare disease patient in Europe waits almost 5 years for a diagnosis. Jessie also breaks down for us the discrepancies faced by Europe's rare disease patient community across the groups of gender, age, and European regional geography. And she also tells us what the survey reveals about the importance of doctors referring rare disease patients to centres of expertise as healthcare systems endeavour to deliver a diagnosis. Ayça and Jessie, thank you very much for joining me.
Thank you for inviting us. Actually, Julian, it's a very great pleasure.
Thank you very much for having us.
Thank you both. So, Ayça, to begin today's discussion about diagnostic journeys across Europe, can you share with me you and your brother's journeys towards receiving a diagnosis for spinal muscular atrophy, or SMA for short? How did your family react? And perhaps can you share with us what exactly is SMA?
So, when we were both diagnosed with spinal muscular atrophy, also known as SMA, as you said, I was 7 and he was about to be 2 years old, and we were diagnosed at the same time. Actually, when we look back now, we can see very minor symptoms of SMA at me. So I had very minor symptoms like trying to climb stairs with just one leg and doing tiptoe walking, etc. So then my brother came to the world and he was a pretty normal, healthy baby. He crawled, but when he started standing and taking a little bit steps, he started falling down. And then they again went to physician and the physician said nothing is wrong and he can wear some orthopedic shoes. But my mother was not convinced at that. When they took both of us to a neurologist, initially she strongly suspected from SMA and asked for a genetic diagnosis, genetic analysis. Then after the genetic test, we were confirmed that we both had SMA. In that part, actually, our diagnosis was very easy. About SMA, I can say that it is a neuromuscular disease, actually, and it is caused by low levels of SMN protein. This is a protein which is crucial for the survival of motor neurons, and its full name, actually, survival of motor neuron protein. So without this protein in a functional and enough level, motor neurons cannot survive and slowly die. And because of the death of motor neurons and loss of motor neurons, muscles get atrophied. And these SMA individuals with SMA slowly loses some abilities like walking, moving arms and legs, or even sometimes breathing. SMA has some types. Actually, I can say 5 types, but 3 of them are very common. Type 0, 1, 2, 3, and 4. And types 1 and 2 and 3 are the common ones. I have SMA type 3. I can still walk, but before Spinraza, the treatment, I was about to lose my walking ability. With Spinraza, I improved a lot. But it is important to state that whatever the type it is, SMA is a progressive disease, even if SMA is not treated.
I see. So when you did receive a diagnosis, what were the positives of receiving a diagnosis, especially as during those earlier years, there wasn't really a treatment for SMA?
Okay, so I always tell this in another perspective. I think SMA diagnosis, I didn't receive a diagnosis actually. My parents received the diagnosis. So I was a kid. I was not told you have SMA. I was just told by time that my muscles are a little bit weaker compared to my peers. We don't learn that we have SMA. We just live with it. So receiving diagnosis, I believe, is very hard for parents, but it is highly dependent on parents to make their children as strong as possible. Because if the parents are strong, we only can be strong, and my parents were like that. The positives of the diagnosis, I believe, we knew what we were dealing with, so they could search for it and they could search for any treatment. There were no treatments at that time, but they found that physiotherapy could be helpful, and they found that the nutrition is helpful. They could search for supportive therapies, and they tried to make the disease progression as slower as possible, and they really successfully managed this. My parents did everything for us. And maybe the negatives could be like our friends were going home after Friday, but we were going to physiotherapy. And there were times we were kids that we said, we don't want to do. So my mother would take us to the McDonald's at the sometimes as a reward after doing physiotherapy. But recently, I just realized that the reward was doing physiotherapy at that time, not the McDonald's. So we owe our parents a lot.
Well, I think in my case, the McDonald's as a perk would have worked at forcing me along to the physiotherapy. Do you perhaps have an idea of what your life or what your upbringing without a diagnosis could have looked like? Would it have resulted in your disease progressing more rapidly, or you living in more pain or with less mobility?
I believe receiving a diagnosis, whatever the disease is very crucial because, you exactly know what you are fighting with. We knew that SMA was our disease, and we were able to track the scientific developments in that area, and we could follow the clinical trials or preclinical studies. We were following everything. We didn't miss any point at that time. And that is why we are also strong advocates of our disease. My mom is the vice president of our Turkish SMA Association, and she is the mother who fought a lot to bring the Spinraza to Turkey. She actually met the president of Turkey twice. She met ministers. She met the deputies in constitution. She tried to reach everyone, but she did it with our other friends in organization, of course, but she had a leading role, actually. She is such a strong soul. I believe my grandpa was also very strong, and I am grateful for my grandpa for raising my mom in such a strong position. I lost my grandpa recently, but I would love to say that's how much I love him in this recording, if it's okay.
It's really impressive to hear about what strong advocates your family was, and know, of course, you're joining us after your grandfather has passed away, who I know is close to you. So thank you for joining, and I'm sure he has plenty of reason to be very proud. So you mentioned, Ayça, that your family followed developments with regard to potential treatments for SMA and research into the condition. I understand that in 2016, the Food and Drug Administration in the United States approved a treatment which possibly provided some optimism for you and your family. How did that particular development of a treatment being approved change your outlook on life with SMA?
Okay, so it was a very special night, actually. It was night at Turkey when the approval was announced. So the first treatment, Spinraza, was approved, as you said, in 2016. And it was like 23rd of December at that time. And it was a Christmas gift to other people. And even though our religion is not Christian, but it was again a gift for us. So at that time, my mother read about the approval and she started crying, like saying that your drug is approved. And it was raining at that night, and she started running under the rain. And it was a very inspirational, unique night for us. Spinraza is an antisense oligonucleotide, and it works by, like, in basic terms, correcting this, including the exon 7, the seventh step in the production manual, actually. And with that, you can have a functional SMN protein, which is very important for the survival of motor neurons. The aim was halting the progression, and any gain was bonus. It was a source of hope for us. Stopping the progression for a neurodegenerative disease is the most important thing. You know that you do not go worse by time. So we learned about the FDA approval, and we immediately start to doing some campaigns. We just wanted that this treatment should be covered by the social insurance, because other patients' lives, my mother always said that to us, other patients' lives are as worth as mine and my brother's life. So actually, we were just watching the videos of my grandpa and my mom, and there's a video saying that my grandpa to my mom, after our drugs approval in Turkey, he says that we are very proud of you, and you did not think of your children solely. You thought about all children, all patients in Turkey, and this is a source of pride. He was very proud of my mother, and watching that video was very good for us, very good for my mother. And I am really proud of my family. If I was born in another family, I wouldn't be this much strong. So our strength, yes, treatment is very important, but along with family treatments and along with education, actually doing everything you can build many beautiful lives, even though you have a rare disease. So you need to fight with others. You need to succeed with others. You need to succeed for all, and no one should be left behind, actually, as SMA Europe's slogan.
Absolutely. And it's a slogan that I think the wider rare disease community would definitely sign up to. So with the treatment now available for people who live with SMA, how did it improve you and your brother's lives over the years? And in what ways has the treatment improved the lives of other people with SMA?
So treatment has impacted our lives in a very positive way. About myself, I was about to lose walking before Spinraza, but with Spinraza, I could walk a little bit further. I realized that my standing time increased, and I was able to stand for a longer time without getting tired. It literally gave us some freedom, also optimism about future. About my brother, for example, he was not able to stand at all for 9 years, actually. But with Spinraza, we gradually tried to do newer exercise. He started standing on his knees with support with a Pilates ball. But then, as he gained some movements back, we built a sliding system in his room that the system takes a little bit weight of him, and we put some CAFO. It stands for knee, ankle, foot orthosis. And with the system, he started standing. Also, without standing, he can lean to the back. For example, can take a little bit hip support. With CAFOs, he can stand. Also, then after some new doses, with that sliding system and with a walking bar, actually, he started taking tiny steps with that walking bar. There are some videos on our social media, and it was a miracle for us. We realized how tall he is after he started standing. And those are the precious moments that, I cannot describe it. You cannot buy these moments. Those are the moments of your life. My brother was not able to use manual wheelchair that people turn the wheels by themselves. He was always using the powered wheelchair. But after treatment, we realized that he can turn the wheels by himself. We benefited a lot from the treatment and we're still benefiting it. Now that there is newborn screening in Turkey, we also tried to make it possible and we succeeded. There are babies who were expected to be a type 1, but they are now walking with treatment. They were treated before the symptoms, and it is important for type 1s to be treated as early as possible. That is why we need to intervene them at earliest time as possible, and all research shows this. So Spinraza improves our quality of lives in a very positive way. And we are very hopeful for the future treatments as well. I know many parents are struggling to find a treatment because there are still countries who do not have any access to any of the treatments, and this is so heartbreaking. So this should not be the case. Every life has equal importance in this world.
Absolutely. It's so important that treatments are accessible and available to anyone who do need them. But the improvements that you've described are really incredible. And you're right to say that they are totally invaluable. You cannot put a price on these kind of improvements to someone's life.
That's so correct.
But of course, the first step towards even receiving that treatment is, of course, a diagnosis. So I would like to start speaking to my colleague Jessie of our Rare Barometer team. Of course, Jessie, Rare Barometer has just published the findings from a huge survey of Europe's rare disease population. The survey was into the diagnostic journeys of people living with a rare disease and the journeys of their families. What exactly was the survey's methodology and scope? How big was it, and how was it conducted?
So it's one of our biggest surveys so far. We rely on a panel of people who are living with a rare disease or have a family member living with a rare disease and who agreed to be invited by email to participate in all of our surveys. And we also rely on the whole rare disease communities to just disseminate our questionnaires as widely as possible. And for this one, we reached more than 13,000 people worldwide and more than 10,500 people in Europe.
Wow, so that's a pretty huge survey. Jumping to the biggest finding, what was the average weight for a diagnosis of a rare disease across Europe, and what kind of variations were found?
So what we found was that between the moment when the first symptoms are noticed and the moment where people have a confirmed diagnosis, on average, it takes close to 5 years. And between those two times, the first symptoms and the confirmed diagnosis, there are also several steps. And one of them, which is quite important, is when people first go and see a doctor to talk about the symptoms for the disease. And this first step happens on average 5 months after the first symptoms. So it means that 90% of the time that is spent searching for the diagnosis is spent in the health system. Of course, this can be different from one country to another, one disease to another. Would it be into the time it takes to reach each of the steps of the diagnosis odyssey or to reach a diagnosis? But on average, for the European respondents, this is what the results that we have. And especially what we found was that it is faster on average for people to get a diagnosis when they are referred to a center of expertise. So between the first medical contact and the time they are first referred to a center of expertise, on average, it takes a bit more than 3 years. But this is only for those who were referred to a center of expertise. And that represents 60% of our respondents, meaning that for 40% of them, they were not referred to a center of expertise. And we see that it extended their time to diagnosis.
So this is a clear opportunity for health systems that are not currently referring as many patients as they possibly can be to centres of expertise. How would you define a centre of expertise, Jessie?
It is a hospital unit that is specialized in the rare disease or in a group of rare diseases. So it's a hospital unit that belongs to what we call tertiary care, because we have people that are very specialized in a type of disease and that have really everything they need, all the knowledge and all the tools that they need to improve diagnosis and care for the rare diseases.
Did the survey find age or gender to be significant factors in diagnostic journey lengths?
Yes, and unexpectedly, what we found out was that when the rare disease appears when the patient is a child or an adolescent, so between 2 and 20 years old, this is when it takes the longest to be diagnosed. So on average, for children between 2 and 10 years old, it takes almost 9 years to be diagnosed. And for adolescents between 10 and 20 years old, it's more than 10 years. And we can see that what impacts this time to diagnosis for children and adolescents, this time is also mostly the time spent in the healthcare system, but also the time in the family. For adolescents, for instance, on average, it takes 3 years before the first medical contact. We cannot really interpret those differences with our results. We can only look at what has been said in the literature on pediatric diseases, and it's mostly pediatric cancers. And what we see is that it can be difficult for parents, first of all, for children and adolescents also, to realize that something is really wrong, that it's not just about growing up or changing or your body changing with adolescence. And then to make the first step in going to see a doctor, and sometimes also for adolescents to go over their fear and anxiety and shame of maybe having something wrong, and then go see a doctor, and then starts the difficulties to knowing exactly which disease it can be in the health system. It is true that for women, it is longer on average to get a diagnosis. So on average, it takes them a bit more than 5 years, for a bit less than 4 years for men, so a bit more than 1 year difference. And this time, contrary to children and adolescents, it's mostly the time in the health system, spent in the health system, that impacts the time to diagnosis for women. So what is important, however, is to be really aware of what we measure when we do a survey. What we measure is the time spent to have a diagnosis of those who answered, would they be patients or family members. And we may miss some things. And for instance, what we may miss would be, for instance, men who don't even go see a doctor, who may see symptoms and not try and understand what it is, what are the symptoms, or who didn't answer the survey as much as women. So what we know for sure is that for women, it is longer to have access to a diagnosis once they enter the health system. What we don't know, however, is how many men do not enter even the health system.
I see. So I guess it's difficult to extract any particular reasons for this disparity. I guess it could be hypothesized that maybe some gender discrimination is a factor in women having longer diagnostic journeys, but it could also be a case that men maybe present to a health system when their symptoms are more severe, perhaps.
So we could not really measure the severity of the symptoms when people went to see a doctor. But what we know, based on other studies that were conducted, is that yes, for any disease, would it be rare or more common, we can see a longer time to a diagnosis for women than for men once they enter the health system. So there could be some discrimination that we need to know exactly how it happens.
I see. Interesting. May I ask whether the survey has shed light on any geographic disparities in waits for a diagnosis across Europe? Is it the case that some regions of Europe provide a diagnosis faster than other regions of Europe?
Yes, actually, what we saw was, for instance, that it was shorter, the time to diagnosis, in Eastern and Central Europe compared to Northern Europe. But when we dug a bit, we thought that the way it could be explained would be that some health system allow to diagnose people with more complex diseases that take even longer to diagnose, that may just not be diagnosed at all in health system that take into account fewer rare diseases or more obvious rare diseases. So it means that, and that's quite important for policy actions and for advocacy, because whenever some indicator is researched or used for policy, and if people want to use the indicator of the time to diagnosis to measure the progress that are being made for rare diseases, it means that even if this measure of the time, the 5 years on average to get a diagnosis is robust, it should not be used for policy purposes or as a goal to reduce it, because reducing the average time to diagnosis for a whole country could mean that we just don't take into account some diseases and many patients.
That's a really interesting point. That's an important nuance that I think policymakers capture. In light of all of these findings from Rare Barometer, do you have an idea of what policy changes would most effectively reduce diagnostic delays and inequities?
So, given that 90% of the time that is spent searching for a diagnosis is spent in the health system, and also that public policies usually tend to focus on the health system, I would say that countries across Europe could really focus, first of all, on building centers of expertise or recognizing centers of expertise and building networks of centers of expertise to make sure that general practitioners and pediatricians know who to refer the patients to, or at least know the system, and that there are centers of expertise in their country, that there are rare diseases, and that those centers of expertise can help diagnosing people living with a rare disease. The second thing is that the main determinant to the time to diagnosis is the age at first symptoms. And as much as pediatricians and awareness of rare diseases and networks of centers of expertise would really help the diagnosis, we saw that those 3 years on average that adolescents with a rare disease spend in the family, even before consulting a doctor, that could be improved by raising awareness on rare diseases in the general population. So raising awareness on rare diseases should be done because what is also important, it's not only the fact that they would refer patients to centers of expertise, but also that they think that it could be a rare disease.
Thank you, Jessie. No, definitely raising awareness across wider society and beyond is definitely a key step towards faster diagnoses. So reflecting on today's discussion, Ayça, what exactly are your hopes for those across Europe who may have SMA but currently lack a diagnosis and are perhaps waiting for one?
So I believe the SMA diagnosis is much easier compared to other rare diseases. I mean, it is one of the easiest diseases to diagnose right now. So lots of medical professionals should be trained for this. I mean, there are very good medical professionals that can recognize SMA, so ask for other tests. So they should never give up. It's research, I believe, day by day, SMA will be a more hopeful disease. It is already hopeful, but every new day will bring new hopes. And I really hope and want the best for other diseases. That is why I wanted to work in science since I was a kid. So I would love to be maybe the tiny piece of that data accumulation, but a piece. So I would love to be just one building block of that wall. And I would love to touch people's lives, which I believe by advocacy, also by doing PhD, I am already doing that. And I would love to do more. I would love to thank every scientist, every parent, every disease organizations, EURORDIS, working for patients. This is very important for us.
Well, thank you, Ayça. Your efforts in science and your inspiration to be one of those building blocks is very worthy, and you should be very proud of all that not just you, but also your family have done in advocating for people living with SMA. Jessie and Ayça, thank you so much for this discussion today. It's been really interesting.
It was very lovely to meet you and doing this conversation. I hope it's helpful for other patients, other people.
Thank you very much, Julien.
Thank you very much, both.